Senator from Vermont.
Mr. President, I rise today to request unanimous consent to pass a bill I introduced with Senator Ron Wyden, the ranking member of the Senate Finance Committee. Our bill, the Repealing the Trump Sick Tax Act, that would repeal provisions of the so-called One Big Beautiful Bill Act, including a provision that excludes certain pharmaceutical drugs from the Medicare drug price negotiation program. It's a provision that hurts seniors, particularly people with cancer, particularly, and helps pharmaceutical companies evade the responsibility to bring to heel their high-price prescription drugs. Our bill would also repeal the provisions of the reconciliation bill that would force Medicaid enrollees to pay out-of-pocket fees every time they need to see a provider. That is nothing more than a tax on patients, and it must be reversed. You know, Mr. President, just this morning, with Senator Crapo and the Senate Finance Committee, we had the opportunity to interview, demand answers, engage with Secretary Kennedy. And over the course of that hearing and in prior hearings, one of the points that Secretary Kennedy tried to make was that members of the Senate, particularly Democrats, and he accused Bernie Sanders, Elizabeth Warren, Michael Bennet, of being pharma shills. Yet Secretary Kennedy and President Trump have championed a bill, the One Big Beautiful Bill, so-called, that literally is a $5 billion bailout for pharma by allowing them to get out of or delay indefinitely and maybe forever the obligation to negotiate fair prices. Let me give an example. Keytruda is a major cancer drug. It's been on the market since 2014. It cost between $150,000 and $170,000 per patient annually. So just think about that. You have cancer, you need this drug. I'm glad it's there, but who can afford that kind of money? And by the way, if it's paid for by Medicare or Medicaid, that means the taxpayers are paying this. It's not sustainable. It's not necessary. And as President Trump has often said, we pay the highest prices in the United States, even when it's us, the United States, that actually backs a lot of the research that goes into creating these drugs. We were making progress on price negotiation to have us achieve a goal of making our prescription drug prices come down, make them more affordable, and not have the U.S. taxpayer, the U.S. employer, and the U.S. families pay the most in the world. It's just not right. The One Big Beautiful Bill also included provisions that would delay the Trump administration from using Medicare drug price negotiations to lower the price of Keytruda. That's wrong. That is wrong. There's nothing beautiful about it except that it maintains a big fat profit. Our bill would also repeal this part of the bill and allow the Trump administration to negotiate a lower price for cancer patients. And I sincerely hope my colleagues will join me in helping pass this bill. Secretary Kennedy and President Trump said that their party wants to lower the price of drugs. I want to do that. And this bill would help us do that. In my goal, we should pass this with unanimous consent. And therefore, Mr. President, I ask unanimous consent that the Committee on Finance be discharged and the Senate proceed to the immediate consideration of S-2447, repealing the Trump Sick Tax Act, that the bill be considered read a third time and passed, and the motion to reconsider be considered made and laid upon the table.
Is there objection?
Mr. President.
Senator from Idaho.
Mr. President, reserving the right to object, the proposal that is sought to be adopted by unanimous consent on the floor today, which means bypassing the Committee of Jurisdiction so that the Committee of Jurisdiction doesn't have the opportunity to work on the bill, is framed in the discussion today as an effort to try to reduce drug pricing. There's no disagreement between Republicans and Democrats on whether we need to reduce the cost of drugs in the United States, and both parties are working on doing it in their own way. The battle here is over government price fixing, and that's something that most of those on our side have resisted for a long time, and that's something that is being pursued in the request in this legislation. The solution is not to have the government take over yet another part of our economy. The solution is to work on market-based solutions like those we are working on. But there's another part of this bill that is being proposed on the floor today that just makes it even doubly objectionable. And that is, this bill has a price tag, and to pay for it, there are provisions in this bill that deal with provisions that repeal provisions in the One Big Beautiful Bill that helped to start reforming our entitlement system. Over the past 2 decades, Medicaid spending has ballooned by over 200%, risking the program's financial sustainability for those who need it the most. This last July, Congress passed some common sense Medicaid reforms. The first time any Congress of the United States has ever sought to do some serious, meaningful entitlement reform, which is the real cause of the debt and the deficit that we face. What we did there was to reduce wasteful and unnecessary spending and to remove disincentives to work. One of those specific reforms required some able-bodied adults, and I mean able-bodied adults who are at least over 100% of the poverty level, to require able-bodied adults to pay a small copay, $35, if they seek medical care under Medicaid. Asking certain Medicaid beneficiaries who have the resources to be able to do it and who are able-bodied adults, who are not disabled, who are not children, and who do not even have to care for children in their home, many of them, to pay a very small minimal amount not only reduces unnecessary health care utilization but it removes a benefit cliff that discourages them from earning higher wages and moving out of poverty. These are those kinds of solutions that I was talking about before that are based on work and markets and free economies rather than on government price fixing and government mandates. Unfortunately, the bill before us today eliminates this important reform and increases unnecessary spending by over $7 billion. More concerning, the bill also repeals a bipartisan policy supported by over 30 patient advocacy groups to spur investment into life-saving cures for patients with rare diseases. This policy offers hope to the 95% of Americans living with a rare disease who lack an approved treatment. The Finance Committee has a deep history of bipartisan efforts to bolster patient access to care and to properly align market incentives to strengthen our federal health care system. Today's bill falls short of those objectives, but I look forward to working with my colleagues on these types of issues and other priorities to achieve these goals. This bill should be reviewed by the Finance Committee, and I commit that we'll continue to work on proper, meaningful entitlement reform and health care improvement across the United States. For those reasons, I object.